sets focused on Corynebacterium diphtheria, each with 5 answer choices and detailed explanations, including why each incorrect choice is wrong. Question 1. Clinical presentation and pathogenesis. A 7-year-old unvaccinated boy presents with sore throat, fever, and difficulty swallowing. On exam, his oropharynx shows a thick gray membrane over the tonsils and pharynx. His neck is swollen, and he has hoarseness. What is the primary mechanism by which this organism causes disease? A. Inactivation of elongation factor 2 by ADP ribosylation. B. Invasion of the bloodstream leading to systemic bacteremia. C. Superantigen-mediated cytokine storm. D. Destruction of leukocytes via leukocidin. E. Inhibition of GABA release in motor neurons. Correct answer: A. Inactivation of elongation factor 2 by ADP ribosylation. Explanation: C. Diphtheria produces a potent exotoxin that inhibits protein synthesis by ADP ribosylation of EF2, causing cell death, particularly in the respiratory tract, heart, and CNS. B. C. Diphtheria is non-invasive. Symptoms are toxin-mediated, not due to bacteremia. C. Superantigen mechanism is seen in Staphylococcus aureus and Streptococcus pyogenes. D. Leukocidin is produced by S. aureus, not C. diphtheria. E. GABA inhibition is the mechanism of Clostridium tetani, not diphtheria. Question 2. Culture and identification. A 5-year-old refugee presents with pharyngitis and a grayish-white membrane on her tonsils. Culture on Loeffler medium shows club-shaped gram-positive rods with metachromatic granules. Which additional test confirms the presence of the virulence factor? A. Elect test. B. Quelling reaction. C. Coagulase test. D. Weil-Felix test. E. Camp test. Correct answer: A. Elect test. The Elect test is an immunodiffusion test used to detect diphtheria exotoxin production. B. Quelling reaction is used to identify Streptococcus pneumonia capsule. C. Coagulase test distinguishes Staph aureus from other Staphylococcus species. D. Weil-Felix test is used for rickettsial infections. E. Camp test identifies group B Streptococcus, agalaxia. Question 3. Complications. A 10-year-old boy presents with fever and sore throat. On examination, there is a thick gray membrane in his throat and cervical lymphadenopathy. 2 days later, he develops an irregular heartbeat and muscle weakness. What best explains these complications? A. Direct bacterial invasion into myocardium and peripheral nerves. B. Host autoimmune response. C. Dissemination of diphtheria toxin. D. Septic emboli from necrotic tissue. E. Vitamin deficiency due to infection. Correct answer: C. Dissemination of diphtheria toxin. Explanation: systemic effects of diphtheria, e.g. myocarditis, neuropathy, are caused by the dissemination of the exotoxin, not direct bacterial spread. A. The organism is non-invasive. Complications are toxin-mediated. B. Autoimmunity is more characteristic of rheumatic fever, not diphtheria. D. Septic emboli are seen in endocarditis, not typical of diphtheria. E. While poor nutrition can affect immunity, it's not the cause of diphtheria complications. Question 4. Prevention. An immigrant child with no vaccination records presents with symptoms suggestive of diphtheria. Which preventive strategy would have best prevented this disease? A. Live attenuated vaccine. B. Killed whole cell vaccine. C. Toxoid vaccine. D. Polysaccharide capsule vaccine. E. Recombinant vector vaccine. Correct answer: C. Toxoid vaccine. Explanation: the diphtheria vaccine is a toxoid, an inactivated toxin that elicits an immune response without causing disease. A. Live attenuated vaccines are used for measles, mumps, rubella, etc., not diphtheria. B. Killed whole cell vaccines are used for polio, IPV, and some bacterial diseases. D. Capsule vaccines are used for H. influenza type B, N. meningitis, S. pneumoniae. E. Recombinant vector vaccines are used for newer diseases like Ebola or COVID-19, not diphtheria. Question 5. Treatment. A 6-year-old girl diagnosed with diphtheria is hospitalized. In addition to antibiotics, what is the most critical component of her treatment? A. Corticosteroids. B. Antitoxin administration. C. Intravenous immunoglobulin. D. Bronchodilators. E. Vitamin C. Correct answer: B. Antitoxin administration. Explanation: the mainstay of diphtheria treatment is the neutralization of circulating toxin using diphtheria antitoxin, passive immunization. A. Steroids are not primary treatment and do not neutralize toxin. C. IVIG is used in autoimmune or toxic shock syndromes, not here. D. Bronchodilators help in asthma COPD but not in diphtheria. Vitamin C has no proven role in diphtheria treatment.